Welcome back, everybody, to DocTalk, and today's show is your prostate inflammation to cancer. Now, whether you believe this or not, but the prostate is going to become one of the most troubling problems for men, and it already has, but the word isn't out there yet. And women, if you're watching this, try to wake your men up, because no offense to men, but you know what? When it comes to their health, they're asleep. I mean, you know, you could find 3 men standing on a corner, and all of them look like they could be 3 months pregnant, and they're all rubbing their tummy, not to get a wish, but they're rubbing their tummy because of the irritation. Because guess what? When you've got a tummy on you, chances are that 85% of your good bacteria have gone bad, okay? All right? And only 15% of your bacteria, okay, are still good. And it could even be worse than that. People do not understand something. They do not understand that the greatest intelligence of the human body on a physical level is your bacteria. Yeah, we're made out of 50 trillion cells, but we're 500 trillion bacteria. And guess what? You know those bad moods? Those bad moods you get are from your bad bacteria. When your bacteria are all good bacteria, happy and blissful, living in that garden called your large intestine, and they're not being poisoned, then you're going to have what? Great moods, great vibes, great information, not disinformation. You know, bad bacteria cause what we call what? Endobacterium. And they give off a gas. And that gas is what blows you up. That gas, you reabsorb it into your bloodstream, into your tissues. Okay. Here's the reality. Your prostate, okay, sits right in front of the last 4 inches of your bowel. Rectum almost killed them. Do you know how you find yourself trying to get that little bit out? Think about all the years that you've been grunting and groaning. All right? And then think about all the years you've been grunting and groaning. That means that there is waste in there that is just stuck inside your large intestine, putrefying, causing this endobacterium, causing fungus, and creating leaky gut, even in that last 4 inches. Oh, it's throughout your whole intestine, but it's causing it there. And understand something. You're absorbing the gas that the bacteria is giving off of, the gas that the fungus is giving off, okay? And guess what? The lining of your intestine is only 1 layer thick. So when infection creates inflammation, inflammation causes what? Disintegration of that layer. We call that leaky gut. So now you're absorbing waste from that last part of your large intestine, those 4 to 6 inches. It goes sigmoid colon, and then it goes rectum, anus. Now, I'm going to be showing you a chart in a little while to show you exactly what's going on, because a picture's worth 1,000 diseases. Okay? Understand something. If we were to totally manage our large intestine, men and women, we would alleviate 85 to 95% of all of our problems. Isn't that something? So I'm not going to go on about this forever, but I'm going to tell you that if you really looked after it and you created the perfect day from the minute you woke up till you went to bed, you would live a life of bliss and joy. You wouldn't have exhaustion. You wouldn't have anxiety. You wouldn't have stress. You wouldn't have inflammation throughout your body. Okay? You wouldn't think that you were getting old. You might be getting older, but you're feeling young still. So here's the reality. So when the waste becomes sluggish, you reabsorb the gas and small particulates of poop. And you're absorbing it through your intestines because it's a muscle. And the less tone that this muscle has, because I'm going to be showing you it's like a snake, and mine is really toned. Most people, that snake is sitting dead and limp in their lower part of their bowel, and it's on top of all other organs. So your large intestine is on top of your small intestine, putting pressure on your bladder, your prostate, okay? And what's that doing? Well, it's cutting circulation off to the waistline. So we call the waistline is your biggest joint, right? You bend at the waistline. That's also where your waistline is. But if your waistline starts absorbing waste, then it's going to go into the pelvis, which is like a big cup, okay? And in that pelvis, that cup, you've got your testicles, you've got your penis, you've got your bladder, and you've got your prostate. And you are what? What are you doing? You're causing a cesspool in there. So when you reabsorb this, when you absorb this waste into your body, it goes into your bloodstream. It's going to go everywhere. But the reality is gravity and lack of tone is going to cause it to come into the pelvic bowl. As it sits in that pelvic bowl, okay, it's going to create inflammation. That inflammation from the infection is going to create inflammation, which is going to cause what? Crystallization. Because we use lactic and uric acid like a glue, because the body's going to send fibrin, and it's going to pull calcium from your hips and from your pelvic bone. So it's going to get calcium, it's going to get lactic uric acid as the glue, and it's going to have the calcium as the cement, and it's going to it's going to create fibrin to come, which is like little scar tissue, and it's going to patch up the inflamed prostate, the inflamed bladder, okay? And it's going to try to patch up the inflamed colon or any place else in that area it gets inflamed, or anywhere else in your body. So a lot of energy is going to try to defend you against your own self-poisoning, and self-poisoning is called an autoimmune disease, because guess what? Autoimmune disease means attacking oneself. So if you attack oneself by absorbing your own waste long enough, you create an autoimmune disease, which means attacking oneself, and you've been doing it since you were a child. Since you were a little boy, you were constipated. Think about all the times you had cramps, all the times you had tummy aches, every time you got a fever. You know that if your bowels were moving, you wouldn't have got the fever. You wouldn't have got sick. Do you know how many people out there right now, you know the situation we're in, that viral thing that's going on? Well, if people were to actually honor their large intestine and cleanse it daily, gently, most people would never have this problem. And I can say that because it's the God's truth. Because once you turn your large intestine from a sewer system, immune system, into a cesspool, that's when you bring the bugs in. You don't have viruses and bad bacteria and worms and fungus until you create a cesspool. The lower you vibrate, the lower vibrational things you bring in your life. The lower you vibrate emotionally, the more bad habits you have, and the more you hang around with people with bad habits. Tell me I'm wrong. Okay? So now I want you to understand this. What you put in your mouth matters. Okay? What you put in your mouth matters. I'm going to give you some basic rules. So we're looking for whole plant-based foods, organic, okay, and fresh. Go to my Perfect Day Guide. And, the best thing to do is to actually email me at quickstart@docofdetox.com. I'll send you my 7 empowering steps. And then go in there and look at the Perfect Day Guide and go to page, I think it's 40, and look from 7 a.m. to 7 p.m. There's the diet, men, as close to that as you can get to. All right? The other thing is guess what? We want to watch what we put in. We want to watch what comes out. And just because there's something coming out the other end doesn't mean we're not backed up for 40 miles. Do you get what I'm saying? And every time that you feel like it's an incomplete bowel movement or you got a strain, that means you're in trouble. Every time that you sit down and it comes shooting out like water or explosive, then you know that you're inflamed and you've got tons of bad bacteria in there. When it comes out like pellets, you know that's a problem. When it comes out like a little string, you know you're constricted. When it comes out like a hard lump and it sinks to the bottom and it cracks the toilet in half, you know you're in trouble. So a good bowel movement is basically 5 to 7 inches long, 1 inch to 1.5 inches in diameter. And what you want is smooth. And when it comes out, you don't want to have to use a whole roll of toilet paper to clean. So all of these things, because your bowel movements are computer printout, okay? Computer printout. And it's going to tell you a lot about yourself. Now, every time that you feel bloated is another time that you're attacking your prostate. Now, whether you want to believe this or not, but prostate problems have gone up 40% in the last 5 years, and they say they're going to go up 500% in the next 5 to 10 years. And I'll tell you why. Because what happens is we are not conscious eaters. We're not even conscious creators. Okay? As long as it's on TV and it gets promoted enough, we'll eat it. If I were to come into your home and go through your cupboards and your fridge and get rid of everything that's processed or GMO, there would be hardly anything left. If you come into my home and fridge and cupboards, there will be a lot left, let me tell you. And there's not going to be much left of you if you don't watch it. So if you don't look at a food, men, and say, okay, is this alive or dead? If it's dead, it's got zero vibration. If it's a live food, it's going to bring in a higher vibration. If it's got fiber, it's going to go in as a scrub brush. And if it's live, it's got enzymes, it's got minerals. So why do we want fiber? Well, when we eat fruits and vegetables, legumes and beans and sprouts, okay? When we do all of these things, it creates a fiber. The fiber, by the time it gets to the large intestine, is fermented. So then it creates really good bacteria. Those good bacteria are your immune system. The other thing, too, is when you sit down at the table, men, don't talk about business. Talk about beautiful, loving things, and make sure that you do not swallow your food until it's a liquid. So you want to what? Chew your liquids and drink your solids. So that means that you're able to actually drink your solids because you chewed your solids so much. You do not have another set of teeth in your stomach. The larger the chunks, the deader the food, okay, the deader you will be sooner, okay? That's how it is. The more inflammation you'll cause, the more infection you'll cause, the more scar tissue formation, crystallization, decalcification, and more prostate inflammation. And understand something. When your prostate starts hurting you, it's ringing like a bell and telling you that you are on your way to not good health, but to an illness. So I hope I've got you started, okay? You can also go and watch The Holy Grail of Healing if you really want to take in more, okay, because we go into greater detail. But I said I would do this today. And understand something. The only reason why you've got a prostate problem, it's not a hormonal problem, so get over it. The only reason why you have a prostate problem is because you have a prostate sandwich. And that sandwich is living in a cesspool of infection. And it all started here with your mouth, but before it went into your mouth, you had to make a choice. So here's the choice. I choose today to love myself and eat only high vibrational, whole plant-based foods that are going to bring life in. And like I said, you can do your own research. Now what I'm going to do is I'm going to show you why you have not just prostate problems, but why you have bladder problems and why you also have trouble peeing, why you also have trouble getting it up. But before we go through the different types of colons, I want to talk about the domino effect. So here's the deal. So we already talked about some things about eating, which you can go and follow up on in my information. But here's the problem. When you do not honor your large intestine, okay, what happens? When you do not honor your large intestine, you absorb waste. You got that, right? When that happens, you lose the tone in your large intestine, so it's limp and it's atonic, right? No muscle. Well, take a look. You're either hanging down or out or you're bloated, right? That's usually the average male today. Okay, not the average, the majority. So now what happens is, I said you're reabsorbing gas and you're reabsorbing toxins. What do you think happens? Well, first of all, your liver, you get chronic fatigue because your liver's trying to purify all this waste that never should have entered your bloodstream. So then your liver starts to get sluggish, right? And it gets really gunked up. And if you want to know how to detoxify that, look at the ultimate coffee enema. Now, once the liver gets jammed up, then the lymph system starts to get jammed up. Then you back up onto your kidneys. Then guess what happens? Then you start having breathing problems. Then you start having skin conditions. And then when everything starts to get really jammed up, you know what you're going to get? You're going to get fevers and you're going to get diarrhea. All right? Why diarrhea? Well, your body says, let's get all the water we can into the bowel and try and flush some of that waste out before this person has a seizure, a stroke, a heart attack, or cancer. So let's talk about the chart. First of all, let's take a look at a normal colon. So when you take a look at a normal colon, that is about the only place you're going to see it is on this chart. Now, that would be the type of colon that we want to see in every individual. But here's the problem. Even in a baby when it's born, that their colon doesn't look like this. Why? Because the mother was doing dairy, the mother was doing sugars, she could have been drinking alcohol, she's doing GMOs, she doesn't know it. You know, you can't do better till you know better. I'm not picking on anyone. But for all the inflammatory, toxic foods that the mother takes in, the baby must take them in. So you as a male or female could have been born with a twisted colon already. Okay? How many children, how many babies are born with bowel problems? Okay? That comes from the mother. And I'm not trying to put blame on you, but what you eat, the baby eats. Okay, so now let's go further. So now if you take a look at colitis, if you look at colitis, okay, here's what I was talking about. So if you suffer from colitis, basically colitis is caused by, again, too much sugar, too much flour products, too much processed foods, okay, and dairy, all right, and not enough water, and the wrong water. People are drinking reverse osmosis, structured, distilled. It doesn't hydrate. So look at structured water on our website. Go to take a look at our structured water units, or go to the library and click on the structured water guide, and you can read about that. You can watch Dr. Gerald Pollack's video on fourth phase water, which is structured water. Now, you see where at the very beginning of the colon, take a look at the colon again. You see the little tail on the left? Well, that little tail on the left is your appendix. Now, you see just above it by about an inch, there's an opening there that you'll see. That's where the small intestine attaches to the large intestine. So the waste is going to come into that area, and that's called the cecum. When the waste hits there, it triggers it. Now, depending on the tone and not inflammation. So inflammation is not tone, because inflammation can cause constriction, can cause it to become hard. You know, the last time you had inflammation somewhere, you tightened up, you constricted, you couldn't open up your arm. Let's say you injured your elbow. Well, you have your arm like this because if you tried to open it, it would hurt. So inflammation is not tone. So we want no inflammation in the large intestine. We just want tone. When that waste comes in the cecum, it triggers it, and then like a snake, the waste will come around. Now what happens is, but you see colitis where it's on the left side of the bowel, and it's coming down near what we call the sigmoid colon, which is where it turns to come to the rectum and anus. Now, right there, you see there where it's really tight, there's a stricture. The problem is that by the time the waste got around this person's intestine, your large intestine, which is 5 to 7 feet long, it was too dry. It was too glicky sticky, because your diet is glicky sticky and toxic. You create inflammation. Because you create so much inflammation in the large intestine, it makes excess mucus, and the mucus is sticky, but the mucus is trying to protect the inner lining that you're burning out. Remember the one cell layer thick? Because you don't want to reabsorb the waste, so it's making mucus. But then the mucus is dry because you don't eat enough whole plant-based foods. You don't drink enough water. You don't put enough life into your body. And with dehydration, by the time the waste gets to the bottom of the large intestine, which is just above your hip by about 2 to 3 inches, on the corner that's going to turn at the sigmoid to go down to your rectum, it's sticky. It's stuck. And it just sits there. It sits there and it sits there. And guess what? The bacteria turn bad. The bacteria give off endotoxin, create fungus, inflammation. The inflammation irritates. So then guess what you do? You see the stricture? That means that real small tightening at the bottom of the picture with the colitis? Well, that's what colitis is. So now it's choked off. Now, believe it or not, that person is going to have to go and get surgery. Okay? Now, if they get surgery, it's going to cause even more scar tissue, and they're probably going to lose a few inches out of their large intestine, which is not really cool. Now, what we would do is we would take a person like that, and we would do Wolfe Non-Surgical. We'd get them to do belly button therapy. We'd get them to do the pelvic enhancer, and we would get them on our different nutritionals and diet, and believe it or not, we could reverse it to the point that that person would never know they had colitis. So you can either get surgery or you can take massive personal action and turn your life around. Now, it's the inflammation that's caused that constriction. So with the inflammation, now you're blocking up all that waste behind it. So what do you think you're reabsorbing? Now, all that waste that you're reabsorbing, gravity, come on, and the less tone you have, it's going down into the pelvic bowl, and then guess what? You're going to knock the living crap right out of your prostate. Now, your prostate's going to become inflamed. All right. So you're never going to hear practitioners tell you the truth. And this is the God's truth. And I'm willing to meet anybody and discuss this professionally. Okay? Now, let's go to the next picture. So remember what I told you about, so take a look at the picture with the diverticuli. So you can call it diverticulosis, which is the condition, or you can call it diverticulitis, which means you have these diverticuli, those outpouchings, see them on that picture? And when we call it diverticulitis, that just means that these outpouchings are inflamed. Are you with me? Now you're going to me, what the heck has this got to do with prostate problems? I just told you, it's your large intestine. You will always have these problems before you have a prostate problem. So do you want me to talk about the prostate problem, or do you want me to talk about what really happens years before you ever had the prostate problem? You know, it's not like you were cursed by God. We know it's not genetic, so something had to cause it. So it had to be being hit with a club over and over and over again before it went into mutation. And that club was inflammation, and that inflammation was caused from infection, and the main part of that infection was caused from your large intestine. Thank you very much. So now, those out pockets that you see, that's waste. Okay, because the waste got stuck, it eats actually through the lining. Did you ever see a long time ago, used to have tires, and they would actually have a bulge, and you'd know, oh, I got to get that repaired. Well, that's all that is a bulge. And once you start doing the things that I ask you to do, those diverticuli, they're gone. They get reabsorbed and healed. They're just trying to save your butt. Instead of having a hole in your bowel and then having blood poisoning and going into shock, you've got these as little luggage racks on the side of your bowel until you wake up. Hopefully you do. Okay, so diverticuli, that's what they're called. Diverticulosis is the condition. Diverticulitis is when they're inflamed. And itis means inflammation, like colitis, remember, colon inflammation. Diverticulitis, okay, inflammation of the diverticuli. All right. Okay. Okay, so now let's go on to what we call a balloon colon. So take a look at balloon colon. And if you look at the balloon colon, so people are either suffering from colitis, I showed you that, diverticuli, or they're suffering from a balloon colon where they're just totally jammed up, constipated, right down just before the last 4 to 6 inches of their colon, and it's all backed up, and then you can see a cup of 3 diverticuli, big ones, sticking out. Okay, so understand something. This is called impaction. Now, in every illness and every colon, I'm not going to go through it today, but I will talk about, eventually I'm going to go back through this chart, and I'm going to tell you what emotion is related to every one of these bowel problems. Are you listening to that? So guess what? It was emotional before it came physical. And when you cannot take a negative emotion and process it properly, it gets stored in the body and it becomes a dis-ease because you aren't at ease emotionally. When you're not at ease emotionally, it becomes a dis-ease physically. So understand, disease names, I don't really care for them. There's a million. They're going to come out with a million more. Don't get caught up in the disease, okay? The disease means a block. No matter what you're talking about in your life, in your body, it means a block. So if a disease is a block, then we know we've got to unblock it, and that's what we know how to do. We know how to unblock the blocks. a tumor is a block, or fibroid's a block, arthritis is a block, sinusitis is a block. Give me something, anything, and it's a block. And that block is made up of, first, it's an energy block, which is an emotional block, and then it becomes a crystallization block or a scar tissue block, or it becomes a calcification block, or all three, and usually all three, because we are in the land of chronic thinking. We don't change our thinking. There could be 100 people all around us that have prostate cancer, and you know what? Or prostate inflammation, and they're all doing the same thing and getting really crappy results, which is the truth, and they're still going to do it. Okay? Chronic thinking. So why would you do what everybody else is doing when they're not getting what they're wanting? Break from the herd. Okay, so now the balloon sigmoid is chronic constipation, right? So we got to get that loosened up. Now, in all of these cases, everybody here needs Wolfe Non-Surgical, where we go in with our elbow, because we've got to go in there and actually take the scar tissue, okay, that knots up. We have to take that apart, okay? So whether you want to believe this or not, wherever you have a disease, you have a knot. And wherever the disease is not looked after, it gets a bigger knot. And then it gets a bigger knot. And now it's a fibroid. Oh my God, now it's a tumor. And now we're going to cut it out. Well, I don't know. Why didn't we just untie the knot? Why don't we untie the knot? Oh, well, that would mean that you would have to take men, that prostate problem. That means you would have to take massive personal action, which means you would have to really feel out your emotions and fill your heart up with love for yourself, to love yourself enough to spend some money, to spend some time, to take some action and show that you care for yourself, which wouldn't be a bad thing, because then you would really be teaching your family that it's okay to love themselves and care for themselves. Now, being the leader of a family, which men are the leaders of families, I don't believe that. I think they're bullies, actually. I think men have become more bullies than they become leaders, and please don't get mad at me, but we've been raised like that. I think the leaders of the families are the women, because they come in with love in their heart, and they're always looking to try to heal the family. And the man is, please, if you want to do that, you go ahead and do that. If you want to go do that, you go. That's why we're in this mess right now. So where are the leaders gone? I don't know where the men have gone. Can somebody tell me? So the reality is, if you could even just take massive personal action, fill up your own heart enough that you could start looking after your body and start scaring the crap out of your children and your wife because of the way you treat yourself, because that's the way most men are, this world wouldn't be in the condition that it's in right now. So that's my little thing on that, okay? So now, that's about balloon sigmoid. So now what I want you to do is take a look at spasm, okay? So we looked at colitis. Now spasm, okay, is where when somebody has a spasm, they usually have diarrhea, or because you see how it hasn't backed up behind the stricture yet. So that's the spasm right there. So they usually have diarrhea all the time, which means that, guess what? Are you ready for this? That means that they're going to live 10 to 15 years shorter. They're not going to have energy. They're always going to have anxiety. They're going to burn their nervous system out, because where that stricture is, they are absorbing so much waste into their nervous system. So what do you think the prostate looks in that person? Holy, that guy, he's on fire. He's on fire. Now, so we haven't backed up waste yet, but we will. Eventually, we will back up waste from this stricture spasm. Okay, but right now, because we've got diarrhea all the time, we're not backing it up. So now let's talk about stricture. So let's take a look at the stricture diagram. All right, so you see the stricture, how you've got, okay, 2 strictures on either end. Wow. Okay, so understand something. Like I said earlier, if you don't do Wolfe Non-Surgical, belly button therapy, and learn how to do clapping, you're not going to reverse this. I'm sorry, but you're not. You're going to go for surgery. You're going to have to. You're going to have to go for surgery. So I'm not telling you to come to me. If you like surgery better, go for surgery. But just understand, when you go for surgery, it causes more scar tissue than anything else you can do. And after you have surgery anywhere in the body, you're going to have to get surgery again if you live long enough. And if you don't want to, then you're going to have to look at coming to us for Wolfe Non-Surgical and for learning how to do proper clapping, Now, if you do that and you do the therapeutic things like skin brushing, salt glow, and you really start caring for yourself, you can reverse these things. So understand something. I will give you a guarantee that you can reverse all of these things. But you're going to have to love yourself enough to love yourself well, because that's the only way you get really well and stay there. You got to love yourself well and then keep on loving yourself well. And that's what we're not doing. And men have a hard time with that because only sissies love themselves. Right, guys? Okay. Now, I'm not trying to pick on anyone. I'm trying to get to people's subconscious. So I just want you to understand that. This is really what it's all about. Understand something. I was there. I was conditioned to be a man, right? Which I'm still a man, but I'm not conditioned, okay? I'm conditioned to love, honor, respect myself so I can do that with my family and others more, because that's how I don't cause terrorism in my family. If I look after me, my family doesn't worry. If I look after me as so-called head in the household, I don't look at myself as that. But as someone older that maybe people look up to, they're going to look up to what I'm doing. If you smoke, if you toke, if you drink, if you eat crap, your children are going to do it, and it's going to cause your wife and everyone else around you to do it because everybody wants to be approved of, even if it's going to kill them. All right. So you're going to have to go to surgery with a stricture, or you're going to have to come and see us, and then maybe even bring your wife and learn how to do the Wolfe Non-Surgical. We have 2 couples here right now. Actually, we have 1 couple, and we have a couple here right now with their little boy because he's got problems from surgeries, and they're here to learn how to do the Wolfe Non-Surgical and learn how to do everything we're talking about here today. It's called a personal treatment and training. And if you don't want to become your own practitioner and learn how to heal yourself and your family, well, then guess what? You're rolling the dice. Not because I'm telling you that people are bad, but it's bad that you don't understand that you were given a body and you're the one responsible for it, okay? And anybody can take care of their body. The only people that can't take care of their body are people that have been programmed to believe they're not smart enough, which is not the God's truth. And nobody's ever going to be as great a practitioner for you and your family than you, so you need to get this. And I can prove this, okay? So now let's take a look at prolapsus, because prolapsus is what we are taking a look at when we see most of the population right now. And when you look at people anywhere from 30 onward, their transverse colon starts to fall. So let's take a look at, please go back to the normal colon and look at that right now. So let's look at the normal colon. All right, so if you take a look where I said the appendix was, you're going to see, go from the appendix. Now, the part that's vertical, that's called the ascending colon. So we're going up. Now, you see when you come to the first corner on your left? Well, that corner is called the hepatic flexure. Now, the hepatic flexure is just underneath the liver. And in Greek, hepatic stands for liver. Now, after you come around the corner, and that's called the transverse colon. Okay, so that's the transverse part of the colon. Then you're going to come up to the corner on the right, and that's called the splenic flexure, because that is just below your spleen. Then you're going to come down the descending colon, okay, and then you see where it starts to turn and like on a highway, a turnoff. Well, that is called the sigmoid, and then we get into what we call the rectum and then the anus. Now, let's go back and take a look at the transverse colon. You see how high that is? That's just in between your belly button and your ribs. And it doesn't sit lower than your belly button, the transverse colon, when you're in good condition. When you start to eat dead food, when you dehydrate, when you don't know how to detoxify, when you do things like drugs, when you do things like alcohol, when you do dairy, lots of flour products, sugar, processed foods, and you don't exercise, move it, you lose it, right? And when you stress the living crap out of yourself and dump what we call hack, which is histamine, adrenaline, and cortisol into your body, okay, those will create acidity, which will cut off oxygen and eat up minerals, which you'll start to lose the tone in that transverse colon. So my transverse colon is coming right underneath my ribs, and it's still there. And I know how to pull it back. So even though I'm getting older, it wants to drop through gravity. That's natural, but I know how to keep it up. You keep that up, and you're going to keep this up. You keep your colon up, you're going to keep this up. Are you getting what I'm saying, man? Okay. So what we see, 99 out of 100 people, their transverse colon is going down, 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 down. Now, people that are bloated, people that their tummies are hanging down and out, their intestines have fallen down. Yeah, I mean, if you really got to take a look at what we call prolapsus, okay, all right, which is an atonic, no-tone colon, you would wonder how the poop even gets out of you. Like, it's like the craziest Hot Wheels racetrack you've ever seen in your life. Okay, so understand. Let's go back to prolapsus now. I want to explain something. Let's start off at appendix. Let's now climb up the ascending colon. Now, look at what we got. Look at the corner. That is a sharp right corner. That's called dead man's curve. Look at the liquid poop has to come and get around there. Why do you think you have pressure under your liver and you think you've got gallbladder problems? Is because you've got gas attack. Because you get gas attack. Most people don't understand it. They think they got gallbladder problems. A lot of times, or liver problems, it's just a gas block. It's a gas bubble. How's a gas bubble going to get up and around? It's hard. It can't travel properly. That's a tight corner, and then it's got to go straight down. That's like a roller coaster ride. So now it's got to come down into the valley, your poop, and because you have no tone, it's going to come down into valley, and guess where your poop's going to stagnate? Right down on top of your pubic bone. Right there. It's stagnating right there, and it's rotting. It's causing pelvic floor rotting. That's right. Your pelvic floor is rotting out. When you've got prostate problems, when you've got bladder problems, your pelvic floor is rotting out. And I mean rotting out. The tissue's getting rotten. Okay? So now, with the waste just sitting in the valley at the bottom, you're reabsorbing that. So you're on fire. Everything's on fire. So now let's move over to the next one. Prolapsus with pressure on lower organs. Okay, so it's really quite similar. But now I just wanted to read that to you because understand something. We're not just talking about the extra 10 to 50 pounds of weight you've got fat and the extra 20, 30 pounds of fecal matter that's all backed up and it's rotting inside of you. Think about that. All that pressure pushing down. How do you think your bladder's doing, your prostate's doing? How do you think your penis is doing? How do you think your testicles are doing? Okay? All right. They're sitting right in the middle of a sewage dump. So now you're saying, well, what a drama queen you are. Well, guess what? If you actually took my drama for reality and you did a reality check, you'll see that your poop smells terrible. You've got bad breath, and your bad breath smells like your poop. You see that your armpits, they have stench. Guys, what we think is normal is abnormal. And right now, I'm the abnormal guy trying to talk normal. Good luck with that, eh, Darrell? So understand something. There's your problem. And understand, everybody too, that when you allow this to happen, you're not just going to have prostate problems, inflamed bladder, bladder infections, testicle cancer, not being able to get an erection. You're also, from this condition, you're going to have low back pain severely, and you're going to have kidney pain. Whether you want to believe it or not, the hepatic flexure and the splenic flexure, those two really tight corners that are right up underneath your ribs, they sit back by where your kidneys are. And don't you kid me that they're not putting pressure on your kidneys, toxic and physical pressure. So understand something. Go ahead, freak out when you got prostatitis, prostate cancer. Do whatever you want to do. Get your radiation, your chemo, your surgery. But understand something. When you love you and you respect that God-given body, because it's issues in your tissues, and understand something. God loved the medical system for emergency care, but why become an emergency? And these are issues in your tissues. They started off emotionally and then became physically because you make emotional decisions on your eating. So the biggest thing that I want you to understand is that everybody's personality creates their reality. So that means that your beliefs and your thoughts shape your day, they shape your world, they shape your body. So understand, everybody is different, okay? So, you know, what we've tried to do, and we've tried to come across as honestly, with integrity as possible. So I'm going to ask you this question. Do you think that if you could create the perfect day for yourself, and that you had a coach and somebody that supported you every day, each day that you have questions that you could call and you could get your questions answered, would that make a difference in your life? Okay, now let me ask you another question. How long does it take to spend $125? Understand something. People can say what they want about me, but the reality is to get charged $125 to do an hour consultation, give you the audio, build your own program, get you started, and then tell you that you can call any of my master consultants or myself, and I mean that. I'll stand behind this for the rest of your life. Because understand something, you're not dumb, you're not stupid. There's a genius in there, and there's a natural health practitioner that is waiting to heal you inside of you already. And we know this. People go, how can you follow through for just that amount of money and then actually help everybody and say you're going to do lifetime support? Because guess what? Everybody wants their life back. People don't want to be reliant on other people. They've been programmed to do that. And that's why I offer this at that price, because I'm going to prove to you that you are not a burden and that we are going to be here for you whenever you have questions, and you need to call us whenever you do. But sign up today for your perfect day consultation. And if you don't believe that we went way beyond what I just said, then we will refund your money without any costs. Thank you. And understand something. Love your prostate well, but only you can do it. Stop making your wife responsible. Stop thinking that that one yearly check with your prostate is going to save your butt. You know what you do? You go get your prostate checked, and then you go, whew, one more year, I'm free of this. Don't do this. Don't stress yourself out. Wouldn't you like to know that you are the master of your mind and your body, and that you will decide the level of your health? God bless. And here's to prostate power. If you're looking for life-saving and life-changing information, well, you've come to the right place. Don't forget to click and subscribe. Stay connected.